A very good evening, everyone. Welcome back. This is Dr. Azam here, your faculty of Anatomy at PrepLadder. Yes, my dear friends, I hope you have actually started with our PYQ challenge at PrepLadder. I hope you all know that. Yeah, a very good evening. I hope you all know that we have actually started with a 50-day NEET PG PYQ challenge. Now, in this PYQ challenge, already you people know very well, the entire schedule has been given to you. And in that, according to that schedule, like last 2 days were actually for solving the PYQs of anatomy. And after completing that one, obviously, like after completing every subject, there is a session which is actually scheduled along with the faculty, respective faculty of that particular subject. And of course, we are going to tell you about the trend, like according to the trend of the questions which are being asked in the last 5 years NEET PG exam. And according to that trend, we are going to see what are the high yield topics and where are the areas where you can actually focus. Okay. Yeah, exactly. That is what I'm trying to tell you here. So this is what we are actually trying to do here, guys. Okay, now fine. So you are actually going to solve all the PYQs in these 2 days, and then after that you'll be actually having the session along with the faculty for a span of like 30-40 minutes or max to max like one and a half hour like that. Okay. Now of course, yeah, Dr. Manish, we are also going to come up with that one. Don't worry about that. Video based questions, we are working on that one. Recently FMG exam was conducted and they were like video based questions given, and yes, of course we are working on that. Give us some time, we'll surely come back with that one. Yeah, new pattern and the clinical questions, everything will be done in that one. Fine. Sir, studied for FMG back in 2023, now preparing for NEET PG from the same notes. Do I need to change my notes? Doctor, whatever the question that you are actually asking me, the answer is hidden in that one. You are preparing separately for two different exams. You have written your FMG exam back in 2023 and you're asking me the same notes shall we use for NEET PG. आपके सवाल में ही आपका जवाब है. जो आप अलग एग्जाम के लिए तैयारी कर रहे हो तो उसके लिए अलग प्रिपरेशन भी चाहिए. If you're preparing for totally a separate exam, separate preparation is required for that one. Of course, you need to have like different notes. Why? Because in a NEET PG exam, almost like 30 to 40% topics will be more additional topics. In depth, those topics will be there in NEET PG compared to FMG. Almost like 30%, I can say. Apart from that, you have actually the notes of 2023. Now it is 2026. In these 3 years, there are like hell lot of drastic changes has happened. There are a lot of updates. There are a lot of additional topics that they're asking nowadays in the last 3 years. So please, I request you, go for the new notes. Okay. चलिए सर आगे बढ़ते हैं. Let us go ahead with our session for today right now. I'll take up your questions later on, but पहले हम जो सेशन के लिए यहाँ पर आए हैं पहले वो डिस्कस करते हैं. Let us discuss about this NEET PG 50-day PYQ challenge. Now, before starting with this entire PYQ challenge right now, let me tell you one thing. I hope yesterday on the doctor's day, like you have seen, there was a news, there was an update in the NEET PG pattern which is actually changed. Okay, and the pattern which is actually changed in your NEET PG exam, I hope you have seen a lot of updates regarding this one on Instagram as well as on the YouTube. Okay, now so many of the faculties have done the session telling you about all those changes which has occurred. So in the last 24 hours, yes, of course, everyone is aware about the changes, like 5 to 6 changes that have happened in the upcoming NEET PG exam, which are going to happen in the upcoming NEET PG exam. आप सबको पता है, number of questions has been reduced to 180 MCQs right now. And again, it is having like 5 sections. There'll be like 36 questions each section. And therefore, the time, of course, if the number of questions has been reduced, the time of each section is going to maintain like the same. The time per question has been actually increased right now. आप सबको ये सब कुछ पता है. Okay. Now, what I am trying to tell you right now is something really important. I want you all to listen to me very carefully for a couple of minutes here. Fine. I know that in the last 24 hours, every student is like sensitized with the updates which are actually happened in the NEET PG exam. ये तो सबको पता है. But solution क्या है? Instead of getting like panicked, Okay, okay, this has happened, this has happened, this has happened. Okay, fine, it has happened. Now whatever notification we got, we need to accept that one. लेकिन अब इसके लिए solution क्या है, हमको सोचना कैसे, how should we actually make up our mind right now for preparation. Okay, so please listen to me very very carefully here. Everyone is just getting panicked कि यार number of questions अगर कम हो गए तो अब क्या होगा, what is the implication of this one. We know that of course the implication will be now the change in the standard of the questions, that is for sure. अगर उसी समय में in the same time if they are asking you the same like less number of questions in that one where you are getting more time for per question, of course the standard of the question is going to be changed. It is going to be like more of clinical integration, number one, and of course you can also expect the video questions kind of thing. Okay, these questions can also come in that one. ये तो हम सबको पता है, fine. But what I want you all to think, like one more point where like most of the students are not focusing right now, what I have observed in the last 24 hours is that suppose you have given the exam and after giving the exam, the ranks has been announced and all those things. So let us do one thing, let's go to that scenario and come back in a retrograde manner. ठीक है ना, हम उस सिनेरियो में जाते हैं जहां पर रैंकिंग डिसाइड होगा और फिर हम वापस इस सिचुएशन में आते हैं कि यार इसका सोल्यूशन क्या करना चाहिए, व्हाट शुड द सोल्यूशन फॉर दिस वन. ओके, so remember my dear friends, what is going to happen when there will be less number of questions has been reduced, fine, almost like 20 questions has been reduced. Therefore now what is going to happen, each question is going to get like additional time. That means every student, every competitor of you, जितने भी सारे आपके कोलीग्स एग्जाम लिखने वाले हैं, everyone is getting like more amount of time for writing the exam, fine. Now what is going to happen beyond certain ranks, I mean to say like above like 1000 ranks or something like that, इसके बाद में क्या होने वाला है, like you will be able to find more number of students with the similar marks, exactly the same thing will happen. Exactly the same thing will happen whenever the standard of the questions will be very much low. मतलब जब सारे topics अब सारे ही students को पता है, when all the topics are known by all the students, like it was like easy questions and all, so how will you actually differentiate the ranking then? तो ये पंगा हो सकता है यहाँ पर. So let us try to understand in a retrograde manner. Yes, my dear friends, remember that what is going to happen, because you are getting ample amount of time to solve the questions, now there will be definitely more number of students with the similar marks. अगर similar marks के साथ में ज़्यादा students होते हैं तो rank tie break हम कैसे करते हैं, how we are actually going to do the rank वाला tie break, जिसके ऊपर कोई भी last 24 hours में actually बात नहीं कर रहा है. Actually people are not speaking regarding this one. I'm like fine, okay, these are the changes, these are like 5-6 changes that have happened in the exam, ये changes है, लेकिन अब इसका implication क्या होगा, what is the implication of that one, when like for example if the two students are getting the same marks, अगर दो students को same marks आते हैं तो हम rank को break down कैसे करते हैं. तो when I have seen the entire PDF for the NEET PG, नीट पीजी के लिए आपके सारे जो प्रोस्पेक्टस में रूल्स एंड रेगुलेशंस दिए जाते हैं, तो व्हेन यू सी दैट वन देयर विल बी अ क्राइटेरिया फॉर द टाई ब्रेकर. If you have like similar marks, now what is the criteria? So what is given here in the very first thing, of course it is given that the candidate who is having the lesser number of negative responses. Please look at this very carefully here now. Lesser number of negative responses in the entire question paper, number one. Number two criteria there, yes, we have like sections, right? Out of that section they are going to see the section A first of all. Lesser number of negative responses in the section A, that is something important. Then simultaneously they are going to go for section B, C, D and E, and then later on अगर उस level तक भी अगर मान लो tie up होता है तो उसको break कैसे किया जाएगा, then they will go for the aggregate percentage marks in MBBS professional examinations, fine. Then the age of the person will also be involved, the older candidate will be given the preference and all. But before moving ahead, I want you all to just concentrate in this first 2 points here, the tiebreaker. The tiebreaker criteria, please concentrate on this one. कहाँ पर होने वाला है, negative marking में होने वाला है. मान लो you and your friend are getting equal number of marks, it is going to get decided based on the negative marking. The more number of negative marking. तो आपको actually retrograde manner में क्या सोचना होगा, what you have to actually think in the retrograde manner here is that yes, please be very much careful with the negative marks. Very much be careful with the negative marks. You are not going to do that guessing वाला work. वो guessing वाला work अब आपके काम में यहाँ पर ज़्यादा नहीं आएगा. That guessing वाला work is not going to help you a lot. Are you understanding, my dear friends? So negative marking मतलब ऐसे सवाल जहाँ पर आपको कुछ doubt हो, तो please it's better to leave that one rather than just guessing wildly. Calculated guess is a very good thing. Educated guess is a very good thing, but not just wildly. अगर आप guess करना चाह रहे हो तो please be double sure about that one. Please be double careful about that one, because this exam is not about the more number of questions that you are going to mark correct. It's all about how you're going to manage that risk of negative marking. तो जितना आप इसका नेगेटिव मार्किंग रिड्यूस करोगे उतना ही आपको ये टाई ब्रेकिंग मतलब आपका रैंक अच्छा होगा. यस, yes, my dear friend. Siddhant, it's not like directly the attempt should be reduced. It's not like attempt should be reduced. It's about that those questions, Siddhant, where you are actually having a doubt. जहां पर आप guess करना चाहते हो वो वाला. Number one point which I am trying to tell you that one. And apart from that, Dr. Siddhant, number 2 point मैं आपको क्या बताना चाह रहा हूँ. Number 2 point is that now when you are preparing for the exam, precision is very much important now. Precision is very much important rather than just getting all as much information as possible. मतलब बहुत सारा information आप बस gather करते जा रहे हो. More than that, whatever you're learning, learn it perfectly to the last word, to the last line of that particular concept. I'm telling you, precision is important. मतलब ऐसे होना चाहिए कि आपने अगर कह दिया कि ये आंसर होगा मतलब होगा. This will be the next investigation of choice. It has to be that one. This will be the treatment of choice. It has to be that one. मतलब इतना precision आपको आना चाहिए. You need to practice to that level. That is something important. तो आपको कैसे यहाँ पर how you have to play the game right now. It's not about like more number of marks that you are going to get correct or something like that. It's all about how you are actually going to manage the negative marking. वहीं पर टाई ब्रेकर होगा, वहां पर आपकी रैंकिंग चेंज होगी. ठीक है ना. तो इसीलिए दैट इज द रीजन व्हाई आई एम टेलिंग यू माय डियर फ्रेंड, इंस्टेड ऑफ जस्ट सेइंग कि व्हाट इज अ पैटर्न चेंज, लेट अस टुगेदर डिस्कस एंड गेट टू सम सॉल्यूशन भी तो चाहिए ना. पैटर्न चेंज तो सबको पता चल गया है. इन 24 hours everyone got to know what are the 5 or 6 changes that has happened. Now the important thing is, yes, अब हम अपनी रैंकिंग कैसे बढ़ाएंगे, how we are going to increase our ranking there. Is it okay? So please keep this point in mind. That is something really important which I actually wanted to convey. Yeah, they are going to be like lengthier questions will be the clinical question जैसे मैंने आपको बताया था. So ranking is ranking के बारे में हमको कैसे खेलना है, that is something like really important. ठीक है ना. तो आपको पढ़ाई करनी होगी with precision. Please remember my 2 points there. पढ़ाई करनी होगी with precision, and after that my dear friend remember negative marking, क्योंकि टाई ब्रेकर में it's given very clearly that it's going to you decide the rank. दो दोस्त अगर सेम मार्क्स आते हैं तो उनका रैंक डिसाइड होगा नेगेटिव मार्किंग से. It's not about the first point is not about MBBS percentage. First point is not about your age, the older candidates. First point is about negative marking. तो उसको जितना आप रिस्क को संभालोगे, जितना ही आप अपने रिस्क को संभालोगे, कम करोगे, उतना ही आपका रैंक ज़्यादा होगा. That is the conclusion I wanted to give you here, guys. Okay. Yes, that is advice I wanted to give you here, guys. Okay now. Is it okay? Yes, guys. Now let us go ahead now with our session. So that is a final takeaway that I wanted to give you. The final takeaway from here is that yes, the same score better rank किसी का हो सकता है, same score पर किसी और का better rank हो सकता है. It's not about how many you attempt, it's all about the few that you get wrong. Negative marking वहाँ पर बहुत कम होनी चाहिए. So it's all about precision game right now. It's all about accuracy right now, guys. Okay. Next one. Now coming to our trend here right now, our session here right now, coming back, this is a very important advice. I request all of you to please share this one with your friends also. Otherwise you can actually share the link of this video and ask them to start watch this starting 5-10 minutes. ये बहुत important advice है, because हमको वो भी तो ध्यान में रखना है कि हम एक्चुअली किस चीज़ की लड़ाई कर रहे हैं. What is the competition all about? So it's all about getting a good rank. So the competition is all about that one. So keep this in mind. Now, my dear friends, coming to our session right now, yes, of course, PrepLadder has actually started with the NEET PG 50 days like PYQ challenge, in which what we are going to happen, you are going to solve the PYQs on the PrepLadder app. Okay, and after that the faculty is going to have a session with you. Like I'm here, last 2 days were given for anatomy. Now in the anatomy I'm going to tell you like what is a trend that we have seen in the last 5 years in the NEET PG PYTs, the previous year topics. What is a trend that we have seen actually? Okay, and I will tell you like topic by topic which are the important topics to be actually concentrated on, which sort of topics to be concentrated on. Fine. Now, now my dear friends, welcome here. In this session, first of all, let us take up neuroanatomy. Now, before moving ahead, I'll tell you one thing here. Whenever you're actually preparing for anatomy, my dear friends, remember in anatomy, upper limb, lower limb, thorax, abdomen, pelvis and perineum, these topics almost every student will be learning. All of your colleagues will be actually learning, guys. Every colleague will be actually learning that one. You know, upper limb, lower limb, thorax, abdomen, ये तो सबको हर कोई पढ़ता है. Everyone will be studying these topics. But in anatomy, your rank will be differentiated based on 3 topics. Number 1, neuroanatomy. Number 2 will be the head and neck topic here. And number 3 here will be the embryology. Because थोड़ा सा ध्यान दीजिए, neuroanatomy, head and neck and embryology, these are the 3 topics which most of the students will fear of. मतलब उनका प्रिपरेशन उतना प्यारा नहीं होता है यहाँ पर, है ना. इट विल नॉट बी दैट परफेक्ट in neuroanatomy, head and neck and embryology. So if these 3 topics, if you are perfect in these 3 topics, of course your ranking will be more better. क्योंकि upper limb, lower limb, thorax, abdomen, pelvis and perineum, all these topics ये तो हर कोई पढ़ता है. Everyone will be studying these topics. But the important thing will be learning these 3 topics. So the more you are perfect with neuroanatomy and head and neck and embryology, remember these 3 topics are really, really important to differentiate, or I can say the tiebreaker for your ranking in anatomy subject, in the subject of anatomy, guys. Okay. So let us go ahead right now, my dear friends. First of all, when it comes to this one, sir, sir, please ask the PrepLadder team to work on the custom modules and GTs according to the new NEET pattern. Of course, of course. It has to be done, and yes, it will be done. It will be done with the team. Yes. Now, in anatomy, remember these 3 topics are very much important: neuroanatomy, head and neck, and embryology. Okay. Now, in this, first of all, in neuroanatomy, if you see in the last 5 years of NEET PG, in NEET PG 2021, we got the question from the cerebellar cortex, the cerebellum blood supply of that one, the brainstem syndromes, as well as the circle of Willis. So whatever I'm telling, it's common sense, my dear friend. Whatever questions, whatever PYQs that we got in the last 5 years is nothing but there is a trend. That is actually the high yield topics that you have to actually look for. Is it okay? This is actually the thing that you have to actually look for. So therefore in neuroanatomy, in NEET PG, my dear friend, to be very frank, what are the topics that they are actually concentrating on? Many a times they are giving the questions regarding the cerebellum. And in the cerebellum, they're giving cerebellar cortex, and that too the histological image of that one will be given. Now, quickly, if you people have solved the PYQs already, try to recall right now quickly. Like what are the 3 layers in the cerebellar cortex? I hope you all remember we are having 3 layers. The outermost one will be the molecular layer, then the Purkinje layer, and then you'll be actually having the granular layer. Now, in the outermost one, the molecular layer, you'll be having 2 cells, 2 types of cells, that is stellate cells and the basket cell. And in the Purkinje layer, you'll be having Purkinje cells. And the innermost one, the granular layer, you'll be actually having granular cells and the Golgi cells. Aapko yaad aa raha hoga. And most of the time in your exam, what they're doing is they are giving you the cerebellar cortex, histological image, and they will always ask you to identify the Purkinje cell. There will be arrow mark and you need to identify that one. I hope all of you remember that the Purkinje cells will be the largest one and they'll be like flask shaped and all. Okay, now? Yes. Now, once you are done with that one, yes, please focus on this topic. Try to recall that one. जो अभी हम जैसे recall कर रहे हैं मेरे साथ में, आप recall करते जाइए. Okay, now try to recall. Fine. See, this is not a time that I'm going to actually teach you the entire thing. Of course, we have been doing that in our rapid revision as well as the LRR thing. Okay. Now, after solving the PYQs, as a faculty, I'm assuming that you are following our challenge or PYQ challenge there. And in that you have actually solved the PYQs. Now along with me, quickly try to recall this one. So cerebellar cortex will be having 3 layers, and in that 3 layers you're having 5 different types of cells also. Done. Now after that, cerebellum blood supply, we know that very well, the ICA, PICA and superior cerebellar artery and all. The most important one, exam paper will not be completed without this one, the brain stem syndromes. So I hope you have seen in the three images which I have shown you. In these three images, I'm done with the brainstem syndromes. That is midbrain syndrome, the Pontine syndrome, and the medullary syndromes. You can go back and check that one. In one diagram itself of midbrain, we are done with the Weber's, the Benedict syndrome, Nothnagel syndrome, Perinaud syndrome, and all those things. Fine. So ये brainstem syndrome बहुत important है, आपको पढ़ना जरूरी है, because in the exam paper will not be completed without this one, sir. And after that, of course, the circle of Willis, they are giving the questions regarding the aneurysm. Now in the chat box, can you please answer me if there is an aneurysm of ACOM, anterior communicating artery, if it undergoes aneurysm, then it is going to compress which structure nearby? Come on, my dear friends. If there is a ACOM aneurysm, anterior communicating artery aneurysm hota hai, so it is going to compress like which structure? Can you please tell me that one, guys? Lovely. That is really nice. Optic chiasm. It means that you have actually solved the PYQs over there. Similarly, tell me if there is a PCOM aneurysm hota hai, so it is going to compress like which structure? PCOM aneurysm is going to compress which structure? These two things you have to actually know. Yes, that is going to compress the third nerve, that is your oculomotor nerve, because PCOM is the one which is going to travel along with the oculomotor nerve. So this aneurysm has been already asked. So try to recall these topics. That is very much important, guys. Okay. So that is about the neuroanatomy. Now, welcome to the head and neck topic, my dear friends. Yes, remember that in anatomy, please don't take head and neck topic easier here. Like a NEET PG examiner is like, hot favorite topic I can say is a head and neck topic, guys. Okay, now first let us see in the 2021 what they have asked. Of course, my dear friend, in the head and neck topic, right, 2-3 topics are there which you cannot leave at all. Like almost in every exam, there will be a question from the cranial foramen and the structures passing through the cranial foramina. And of course, the cranial nerves, no doubt about that. Mandibular nerve, always there'll be a question asked from there. The facial nerve, there'll be a question asked from there. And apart from that, the cranial nerve nuclei and columns. Okay, so cranial nerve nuclei and the columns of this one. That your favorite part, GVA, GS, and all those. From these, the questions will be definitely asked, guys. So all the cranial nerves we have learned actually in detail. In fact, in the rapid revision session also, I taught in detail about that one. So you can now check here one by one in every year. First of all, facial trunk, nerve trunk identification. अगर आपने PYQs अगर आपने solve किए तो आपको पता होगा, they have already given this question, how to identify the facial nerve trunk. Okay, so in that options, one of the option was given as omohyoid muscle. Omohyoid muscle बहुत यहाँ पर नीचे होता है, so that is not the feature for identifying the facial nerve trunk. So digastric muscle over here, the tragus part over here, and then coming in a retrograde manner from the branches of the facial nerve. That is something important. Apart from that, thyroid swelling movement is prevented by the thyroid swelling, the movement hota hai, that is prevented by which one? I hope you remember the concept regarding the deep cervical fascia, ligament of Berry, as well as the sternothyroid muscle over there. Now, this is something important, my dear friend. Tongue papillae. Nowadays, they are asking a lot of questions regarding this one. Tongue papillae, you can also see it was also asked in the NEET PG 2024 also. Okay, in this, can you please answer me question number 1? Out of all the papillae in the tongue, which papillae does not have the taste buds? Which papillae does not have the taste buds? Come on, answer me quickly, guys. We are going to recall all the PYQs right now, whatever you have solved in the last 2 days. Filiform papillae. Filiform papillae. What about the other people? Come on. Which papillae does not have the taste buds? Absolutely right. That is a filiform papillae. Fine. Now, question number 2. Can anyone tell me here? The second thing here, like normally what kind of epithelium should be there in the oral cavity? Inside the oral cavity, it should be like multiple layered. So it should be stratified. Of course, in the oral cavity, you'll be having stratified squamous epithelium. Fine. But that stratified squamous epithelium normally inside the oral cavity, it should be keratinized or non-keratinized. It has to be non-keratinized, right? It has to be like non-keratinized, but there is a papillae which is actually covered by keratinized one. Keratinized stratified squamous epithelium. Can anyone tell me which papillae of the tongue is covered by keratinized stratified squamous epithelium? Which papillae of the tongue will be covered by keratinized stratified squamous epithelium? Again, the same answer, filiform papillae. Absolutely right. So please remember these 2 points for the filiform papillae. Come on, let us revise the PYQs. Number 1, yes, it will be covered by केराटिनाइज्ड स्ट्रैटिफाइड स्क्वामस एपिथेलियम, प्लीज डोंट रूल आउट दैट ऑप्शन। देखो यही तो हम कहते हैं, दैट इज द रीजन व्हाई इन द रीसेंट रैपिड रिवीजन सेशन वी केम अप विद एरर फाइल्स। नॉर्मली स्टूडेंट्स क्या होता है, एवरीवन विल बी थिंकिंग, अच्छा अगर मान लो एग्जाम में, हाउ द माइंड वर्क्स इन द एग्जाम, 19 सब्जेक्ट इन योर माइंड, यू आर थिंकिंग अबाउट ऑल द सब्जेक्ट्स, यू नो, सडनली द क्वेश्चन विल कम देयर। तो हमारे माइंड में क्या होता है, अगर ओरल कैविटी होगा तो यार ऑब्वियसली नॉन केराटिनाइज्ड होना चाहिए, है ना। Don't make this error. Try to learn from the error files there, guys. Don't make this error right now. It will be covered by keratin, be like more wider. And not only that, they'll be actually having a groove or a trench on either side. So there will be a groove, or we'll call it as trench, on either side. By that, we'll be easily able to identify the circumvallate papillae. By the way, we know that circumvallate papillae are present in the anterior two-thirds of the tongue. Fine. And the anterior two-thirds of the tongue, agar hoga, so tell me, what is the nerve which is going to carry the taste sensation from the circumvallate papillae? Which nerve is going to carry the taste sensation from the circumvallate papillae? Quickly. I repeat again. We know very well circumvallate papillae will be present in the anterior two-thirds of the tongue. So for example, if this is your tongue here, it will be divided to anterior two-thirds and posterior one-third. Circumvallate papillae yahan hote hain. Now tell me, which nerve is going to carry the taste from the circumvallate papillae? Absolutely correct. It is actually the ninth nerve. Ninth nerve. Actually क्या होता है, in the anterior two-thirds we remember the taste will be carried by the seventh nerve, and to be more specific, it is the chorda tympani branch of the seventh nerve, right? Many of the students I can see there in the comment box, they are mentioning chorda tympani branch. Yes, welcome to the error files. That is what I told you in the beginning of the session. This exam is not about these kind of guesses. Precision is important. नो गेसिंग वर्क, क्योंकि टाई ब्रेकर, रैंक का टाई ब्रेकर क्या होगा, नेगेटिव मार्किंग होगा। तो ये अगर नेगेटिव मार्किंग अगर आप इस बार नीट पीजी में करोगे, इट विल बी वेरी वेरी मच बैड। ओके ना, ये बहुत गलत हो जाएगा आपके एग्जाम के लिए, आपके रैंकिंग के लिए। एंटीरियर टू थर्ड टेस्ट सेंसेशन विल बी कैरिड बाय chorda tympani branch of the seventh nerve, but except which one? Remember, except the circumvallate papillae. Even though they are present in the anterior two-thirds, remember from here the taste will be carried by the ninth nerve. Please go and watch my at least the rapid revision sessions right now. Right now, my dear friend, the concept has to be like crystal clear. Precision is very much important. Okay, समझ में आ रहा है सेशन का इंपॉर्टेंस क्या है? So after solving the PYQs, if you spend some time with the faculty, this is going to help you a lot. Now after that, tongue papillae जो हमने सारे points discuss किए हैं, welcome here my dear friend. This is nowadays the trending topic, submandibular gland resection. Submandibular gland resection, recently it was also given in the 2025 exam also last year. Now what is going to happen, they will be giving a clinical question, the long stem one, 4 to 5 lines will be given to you, and that is going to get integrated with your surgery subject. Okay, now they'll be giving a history, a man aged about so and so, and he was consuming that gutka, tobacco and all those things, and because of that somehow someday we need to actually remove the submandibular gland. Submandibular gland resection has to be done. Is it okay? So once you remove that one, at that time what is the most common nerve to be damaged, that they'll be asking you, and for that you actually have to remember about the relations of hyoglossus muscle. Okay, now yes, lingual nerve, absolutely correct over there, Dr. Aniket. So I hope you all remember, if this is your tongue here, and below here, if this one is your hyoid bone here, hyoid bone will be actually having the body of the hyoid bone, lesser horn and the greater horn. And from the hyoid bone, what is going to happen? There will be hyoglossus muscle going inside the tongue. That is the hyoglossus muscle. Now, what are the relations that you have to remember? There will be a nerve which will be going from here. Okay, and it is going to pass through a ganglion, and this nerve will be the lingual nerve, and lingual nerve is going to pass through which ganglion? Come on, answer me quickly in the chat box. That is your lingual nerve, and lingual nerve is going to pass through which ganglion? It is passing through one ganglion. Of course, this ganglion here will be the submandibular ganglion here, guys. And apart from that, there will be one more nerve which is going to pass from here below. That is your 12th nerve. So this one here will be the lingual nerve, and this one here will be the 12th nerve, and that nerve is going from the below and going and supplying to all the muscles of tongue. That is the reason why the name of this nerve is given as hypoglossal nerve. Hypoglossal nerve going from below the tongue. That is the 12th nerve. And then apart from that, there will be a gland present over here. And this gland here will be the submandibular gland, guys. Submandibular gland. तो आप ऐसे भी याद रख सकते हो. Some students remember in this manner also. The nerve which is going to be shown in the image above the submandibular gland, this nerve here will be the lingual nerve, and below the submandibular gland, this one here will be the hypoglossal nerve, the 12th one. Fine. Is it okay? Fine. Now this submandibular gland, it is going to give rise to a duct, and that duct is going to take a turn around this lingual nerve. And of course, what is going to happen? Whenever you're going to do the submandibular gland resection, most commonly, of course, the lingual nerve can be damaged. Fine. Now, अब मैं क्या करूँगा आपके NEET PG एग्जाम में, I'll just confuse you with one more thing. Try to answer me this correctly. See, precision जो हमको डेवलप करना है, error files में जो हमने precision डेवलप किया है ना. Now, this one here will be the hyoglossus muscle. From the hyoid bone to the tongue, hyoglossus muscle, and this one here will be the submandibular gland here. Fine. मान लो मैंने आपको एक cadaveric image दिया. I have given you this cadaveric image in the exam, and after giving you the cadaveric image here, I have just marked identify the arrow mark structure. You need to identify the structure right now. Now I'm like really happy. In the chat box, many of the students have answered that very clearly that it is submandibular gland. Fine. Now, just to confuse you, I'll give you two options. In one of the option, deep part of the submandibular gland, and number two option will be, yes, superficial part of the submandibular gland. Now, can you please look at this diagram and tell me, is it the deep part or the superficial part? Is it the deep part or the superficial part of submandibular gland? Deep part or the superficial part of the submandibular gland? Come on. Absolutely correct, Dr. Shivakumar. It is actually the deep part. Please remember, it is actually the deep part. Remember, the deep part of the submandibular gland is present superficial to hyoglossus muscle. The deep part of the submandibular gland is present superficial to hyoglossus muscle. How come this is the deep part? Why? Because try to recall from the anatomy classes. I think you might have even studied in surgery also that submandibular gland is actually going to take a turn around a muscle present here, and that will be the mylohyoid muscle. So if suppose my hand here is like mylohyoid, the submandibular gland is around that one like this. So this one here will be the superficial part here, and this is actually the deeper part. And the deeper part is actually the superficial to hyoglossus muscle, guys. The deeper part of the submandibular gland is superficial to hyoglossus. Precision is important in this NEET PG exam. Please don't make this kind of errors. There is a negative marking there. Is it okay? तो यही तो आपको बताने के लिए we are actually doing this session over here, guys. Next, coming to the NEET PG 2002. In 2002, they have actually asked about the hot favorite of the NEET PG examiner, the cranial foramen and the structures passing from the cranial foramen. At least you should be like perfect with superior orbital fissure. No doubt about that. Then the foramen ovale, जहाँ से male structures pass होते हैं, and then the jugular foramen, my dear friends. Superior orbital fissure, the foramen ovale, and the jugular foramen. These three will be like the hot favorite of the examiner. I'm telling you, NEET PG examiner. Fine. So I hope you'll be done with that one. Now answer me this question. Welcome to another very important topic for your NEET PG. Muscles of mastication 2023 में पूछा गया था. Now, muscles of mastication, many a times they are given like image-based questions and all those things. Can you please answer me this question here? Locked jaw while yawning. Which muscle of the mastication will be involved here, sir? When there will be a locked jaw while yawning, which muscle will be involved? While yawning. Lateral pterygoid, that's really nice. And suppose if I don't use this word yawning here, sir. मैंने आपको just direct सवाल पूछा कि what is the muscle which is involved in just the locked jaw or the trismus? So what is the muscle involved in the locked jaw? Then your answer has to be the medial pterygoid. Very good, very good. See, this is what is the precision that we want in your NEET PG exam this time. Okay, I'm like really happy with this one. अगर आपको सिर्फ locked jaw दिया जाएगा तो आप medial pterygoid mark करोगे. While yawning दिया जाएगा, then your answer has to be the lateral pterygoid. Deep cervical fascia, the four modifications of that one, I hope you remember. The pretracheal, the prevertebral fascia, as well as the investing layer and the carotid sheath guide. Okay, now deep cervical fascia में investing layer से जो सवाल पूछा गया था about the mumps, mumps will be like very much painful. Why? Because of the unyielding nature of the investing layer. That is something like really important. Fine. Then apart from that, carotid sheath, I hope you all remember, one more modification of this one will be the carotid sheath, guys. In carotid sheath contents, every student knows that internal carotid artery, yes. Common carotid artery, yes. Even the internal jugular vein will also be a content, and even the vagus nerve, the 10th nerve. In your NEET PG exam, what they have done is, along with this one, they have also written there as 9th nerve. After the exam, I have asked this question to many students. They answered, sir, it was clearly given as 9th nerve, not the 10th. 9th nerve is a content of the carotid sheath. Now tell me, is it a true statement or the false statement? Is it true or false? Absolutely true. Even 9th nerve is also a content of the carotid sheath. Yes, absolutely correct over there. Thank you. Yes, even the 9th nerve is also a content of the carotid sheath, but remember, it's a false content of that one. Why it is known as the false content? Why? Because it's not present throughout the entire length of the carotid sheath. It is only present in the upper part of that one, the cranial part of that one. That is why this one is actually the false content. लेकिन ये भी carotid sheath का content है. ये NEET PG exam में दिया गया था. It was given in the NEET PG exam. Take care about that one. And apart from that, मैंने आपको already बता रखा है, submandibular gland resection, cranial foramen and the structures passing from that आपको पता होना चाहिए, as well as digastric muscle, the nerve supply, image based question was given, and of course the favorite topic is about the cranial nerve nuclei and the columns. Now welcome to the third important topic that is important in anatomy for tie breaking or getting a better rank, I should say. Neuroanatomy, head and neck and embryology. Now embryology में NEET PG में अक्सर मैंने यहाँ पर देखा है कि don't leave the general embryology, guys. I mean to say in NEET PG most of the time they're asking questions from general embryology जो आप बहुत easily मतलब you will be just omitting that one, like spermatogenesis, oogenesis, like you know meiosis, mitosis and all those things. वहाँ से बहुत सारे बार कई बार आपके ना NEET PG एग्जाम में सवाल पूछे जाते हैं. Many times the question has been asked from there, like fetal circulation, about the meiosis. Now simply once the question that was asked was about the meiosis, and meiosis occurs where? Now everyone knows that the meiosis will occur in gonads, right? Gametes will undergo meiosis, reduction, division वहीं पर होता है gonads में. It has been given that you know ovaries में तो होता ही है, सबको पता है. But this was not given in the option. Testis was given in the option, and that two options were given: pre-pubertal testis or post-pubertal testis. Come on, answer me here. अगर आपने last 2 days में PYQ solve किए हैं, answer me quickly here right now. Yes, the meiosis will occur in pre-pubertal testis or post-pubertal testis. Yes, the right answer there will be the post-pubertal testis. Keep that in mind. And आजकल ये तो hot favorite question है. I think everyone now knows the concept very well. Out of the two recurrent laryngeal nerve, the left recurrent laryngeal nerve is like more longer. You people know very well why the left recurrent laryngeal nerve is longer. You know from gross anatomy that it is more longer. Why? Because it is going to take a turn around the arch of aorta. Around the arch of aorta, ये आपको पता है. But nowadays they are asking the question from embryology, not from the gross anatomy. The left recurrent laryngeal nerve is more longer because of the sixth arch artery. Sixth arch artery is the one which is going to form the ductus arteriosus. You know, even that question has been asked there. Ductus arteriosus is formed from the left sixth arch artery, and that is not allowing the left recurrent laryngeal nerve to move up. So because it is not allowing to move up there, therefore it is going to take a turn around the arch of aorta only. So left recurrent laryngeal nerve is more longer because of the sixth arch artery. Keep that thing in mind. And yes, of course, the derivatives from the ventral and dorsal mesentery, that is also very much important. Let me ask you the question here. Can anyone answer me? The falciform ligament will be derived from where? Ventral mesentery or dorsal mesentery? Falciform ligament, it was asked recently in your NEET PG exam. Yes, falciform ligament, it was given as an image based question. It is derived from which mesentery? Ventral mesentery, right in front of the liver. Absolutely right. Lesser omentum is derived from where? Lesser omentum will be derived from where? That is also derived from the ventral mesentery. Absolutely correct. Now similarly tell me about the splenorenal ligament. Splenorenal ligament is derived from where? Splenorenal ligament will be derived from where? And that is actually derived from the dorsal mesentery. Yes, absolutely correct. Absolutely correct, Dr. Singh. Fine. Okay, that's really nice. Now, once you are done with this one, of course, as I told you, patent ductus arteriosus, the left sixth arch artery, that is a thing from where it is actually derived. And don't forget about the umbilical cord contents and all. Umbilical cord के सारे contents आप सबको पता ही होंगे. And apart from that, the important thing is about what is derived from allantois. Remember, allantois is actually the one which is going to form that urogenital sinus. And the cranial part of the urogenital sinus will be known as the urachus. Now, these two structures are actually coming from allantois only. It is the one which is going to form the urogenital sinus as well as the urachus. Now, urogenital sinus has to become what? Urinary bladder. It is going to become urinary bladder, fine. And the cranial part of the urachus will be closed, and that will be closed to form a ligament known as median umbilical ligament. Be careful with the spelling, it is not medial, it is actually median. Median umbilical ligament, guys. Done. Now, even omphalocele, the question has been asked. Yes, answer me like one by one, 3 questions from here. Yes, question number 1 here. What about the rotation of the midgut? Midgut is going to rotate how much? Come on, answer me quickly, guys. Midgut का rotation कितना होता है? How much is the rotation of the midgut? Yes, very good, Dr. Bharat. It is going to rotate like 270 degrees in anti-clockwise direction. Number 2, in NEET PG exam, they have asked physiological hernia. Can anyone tell me when will the physiological hernia occur? When will the physiological hernia occur? Can anyone tell me when will the physiological hernia occur? No, 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 Dr. Bharat. Yes, absolutely correct. That is in the 6th week. I hope you all remember about physiological hernia. Welcome here, my dear friends. Don't worry. अगर आपको नहीं पता है, someone is like continuously people are writing there as 10th week. Please look at my question very carefully. Welcome to NEET PG exam. Precision is required here. When will physiological hernia occur? I hope you all know very well, midgut development is going to take place, and while the midgut is going to form there is no enough space to accommodate the coils of long coils of jejunum, long coils of ileum. You cannot accommodate that in your abdomen there. That is the reason why that midgut is going to come out via umbilical opening, and that is going to come out during 6th week. And when it is going to come out via the umbilical opening, of course I can call it as hernia. And remember, this one is actually the physiological hernia, not the pathological hernia. और ये सवाल आपके NEET PG exam में पूछा गया था. So when will the physiological hernia occur? That is 6th week. Question number 3 here is reduction of physiological hernia. Reduction of physiological hernia, and that is going to be taking place in 10th week. जो आप सब लोग actually chat box में answer कर रहे थे 10th week, 10th week, 10th week. रट्टा मत मारिए. Don't try to mug up physiological hernia 10th week. Try to learn the concept properly. So what is the concept here? Physiological hernia will occur by 6th week, and it is going to reduce by 10th week. So if there is a reduction of physiological hernia, that is by 10th week. Now you and me, thank God our development is perfect. Your midgut, my midgut came out, rotated, went inside. Okay, but there are some unfortunate babies, midgut is going to come out, but it will never reduce back. So failure of reduction of physiological hernia. Failure of reduction of physiological hernia, and that is nothing but omphalocele. Omphalocele, even image based question आपके exam में पूछा गया था. I think many errors are getting rectified here. है ना, my dear friends? Give me a thumbs up here. So I don't know whether you have solved the PYQs in the last 2 days or not, but thank God you have joined this session over here and see हम हमारे इस सेशन में कितने सारे आपके एरर्स यहाँ पर रेक्टिफाई हो रहे हैं ना. Yes. Now, once you are done with this one here, embryology, the next thing is let us take up upper limb. In upper limb, please don't go to the exam without learning about the ulnar nerve and the median nerve and the radial nerve, my dear friends. Of course, there will be questions coming from here. Ulnar nerve, median nerve and radial nerve. Recently in the FMG exam, exactly the same thing happened. Many questions came only and only from the upper limb topic. Almost I'm telling you 6 to 7 questions came only and only from the upper limb topic. I'm telling you 6 to 7 questions. There was a question about the fracture of shaft of the humerus. सबसे पहले आप मुझे ना ये बताइए, first of all tell me one thing here, humerus bone में अगर मान लो यहाँ पर shaft fracture होता है, there is a fracture in the shaft of the humerus, then which nerve will be involved? Which nerve will be involved here, guys? A radial nerve will be involved, because radial nerve is the one which is going to pass in the spiral groove. Suppose if there is a medial epicondyle fracture here, The medial epicondyle अगर यहाँ पर fracture होगा तो ulnar nerve is the one which is going to pass behind that one. And yes, of course, there is a nerve which is going to pass behind the surgical neck of the humerus, and that nerve here will be the axillary nerve, guys. So axillary nerve is going to pass behind the surgical neck, and then radial nerve is going to pass behind the shaft of the humerus. Recently in the FMG exam they have given about the fracture of the shaft of the humerus. Radial nerve वाला सवाल पूछा गया था. And median nerve, of course, they have given about the pointing index. Okay, na? Ask the patient all that, entire clinical question was given, big stem and the pointing index image was given. And about the ulnar nerve, the card test. जो आप मुझे बार बार पूछ रहे हो, again and again you're asking me in the chat box about the video question, sir. That was given in the recent exam. Video question was given about the test. Which test? Card test. अब यार कार्ड टेस्ट, ये इमेज तो हमने कई बार देखा है. वी हैव सीन दिस इमेज मेनी अ टाइम्स. देयर इज अ कार्ड गिवन टू द पर्सन इन बिटवीन द टू फिंगर्स, है ना. वी हैव सीन दैट इमेज, एग्जैक्टली द सेम इमेज. दे आर जस्ट गिवन इन द फॉर्म ऑफ द वीडियो. They have just given in the form of the video. Students told me that clearly, sir, only one hand was there. There was a card, and the card was held between the fingers there like that. Card test. And the question was very simple. It seems that they have just asked, this is actually done for which nerve there. Of course, the nerve will be the ulnar nerve. And I'm really happy, Dr. Bharat over there, they're even telling me about the muscle that is also involved there, palmar interosseous. Not only card test, they're also asked about the book test also. And book test is even hot favorite of the NEET PG examiner also. From and sign was actually given in the NEET PG exam. And this time they've also repeated that in the FMG exam also. So please don't go to the NEET PG exam without learning these three topics: ulnar nerve, median nerve, and the radial nerve. And one more hot favorite topic of the examiner in upper limb, when it comes to upper limb, my dear friend, anatomical snuff box. I should not even tell anything regarding that one. आप सबको अच्छे से पता है. Anatomical snuff box, okay na? I hope you know the boundaries. मेरे साथ में फटाफट रिवाइज कर लीजिए. Laterally there will be like two tendons over here, है ना? Abductor pollicis longus, extensor pollicis brevis, and medially there will be one tendon here, that is extensor pollicis longus. And please remember, in the floor of that will be having a scaphoid bone, which is most commonly fractured. Even that question is being asked. And one more thing is, your NEET PG examiner is interested about the attachments on the upper end of the humerus. Please look at these images and go to the exam. I mean to say, all these muscles which are actually attached over here, important. आपको याद होगा, recently cadaveric image was given. In that cadaveric image, pectoralis major muscle was actually reflected. And pectoralis major muscle was reflected, and then beneath that minor, there is a nerve going to insert that one. Which nerve is that one? We need to identify. So what I'm trying to tell you is that these muscles, once they have given the muscle over here, levator scapular muscle image was given, and recently attachment of the triceps muscle, long head of triceps कहाँ पर attach होता है? Infraglenoid tubercle पर attach होता है. So attachments of all these muscles at the upper end of the humerus and identifying these muscles is very much important for NEET PG. Okay, so in this session, whatever we are analyzing here, before going to the exam, upper limb topic में, suppose you are going to the exam this time, upper limb topic में हमको तीन चीजें रिवाइज करनी है. Number one, you are going to revise the major nerves. Number two topic, anatomical snuff box, important here. And number three topic is about the, all these muscles around the pectoral region here. Muscles around the pectoral region, they're asking. Muscles around the pectoral, front view and the back view. Please look at those muscles carefully and go to the exam. In fact, in the PrepLadder app, recently I've also recorded the cadaveric, videos also, and you can even watch them for all the cadaveric images and how to identify the nerves, muscles, and everything. Okay. Then when it comes to lower limb, that is mostly about the sciatic nerve, guys. Sciatic nerve, आप अच्छे से पढ़ के जाइए, वहाँ से definitely एक सवाल आता है. जो recently आपके FMG exam में पूछा गया था, that was about the common peroneal nerve injury. See, they have given the same thing. Common peroneal nerve injury, NEET PG exam 2023 में दिया गया था. Welcome to FMG 2026. They have given recently the same clinical question. Okay, there was an injury to the person near the neck of the fibula. Location याद रखिए. Neck of the fibula was given. Common peroneal nerve injury, neck of the fibula. The same keyword was given recently in the exam. And don't try to forget those small topics, my dear friends, especially the tarsal tunnel and all the structures going inside the tarsal tunnel. And nowadays they have started asking about the meralgia parasitica. फटाफट मुझे बताइए, in meralgia parasitica, what is the nerve that is getting compressed? Answer me quickly. Of course, you people are telling the correct thing about the common peroneal nerve injury. Fine. In meningia parasitica, yes, lateral cutaneous nerve of the thigh is involved. Very good, Dr. Danush. Very nice. And of course, Dr. Praneeth, absolutely fine. Absolutely correct. The root value of that one will be L2 and L3, guys. And after completing this one here, yes, thorax not much important for your NEET PG. And from the last 5 years in the abdomen topic, abdomen, pelvis and perineum. Yes, of course, my dear friends, inguinal canal is very much important. The blood vessels, celiac trunk, superior mesenteric artery, their branches, relation with the pancreas. Okay, relation of the superior mesenteric artery with the pancreas, that is important. Okay, so to summarize here, what can I tell you is that, inguinal canal is very much important. Number two, the blood vessels of abdomen, very, very much important, guys. Abdominal aorta, the celiac trunk, superior mesenteric artery, everything is important. And third thing, what I have observed the trend is anal canal. Most of the time, the students will actually ignore this topic, my dear friend. Please learn this topic and go to the exam. Why? Because anal canal, lymphatic drainage, related with the even portocaval anastomosis also, they are asking there in the exam, in the NEET PG exam. And just to recall you right now very quickly, I hope you remember when you learn about the anal canal, we'll be dividing that with the help of a line there. Can you please recall that name of the line? Come on, my dear friends, can you please recall the name of that line? There will be a line there in the anal canal, and we will be learning the differences above that and below that one. No, no, no. Come on. Pectinate line. Yeah. Yes. So above the pectinate line and below the pectinate line, okay, now that pectinate line, those differences, in fact, the development is also different. Above the pectinate line, that is a part of your gut that is derived from your endoderm, and below that it will be actually from ectoderm. The arterial supply, venous drainage, lymphatic drainage is also important there. They are going and draining into which lymph, they are correlating clinically with the carcinoma and all. So please remember those differences. So for your NEET PG exam, when it comes to abdomen, pelvis and perineum, anal canal topic, most of the time the students will be missing. They'll be learning about inguinal canal, well and nice, well and good. Blood vessels also they'll be learning, but anal canal, please remember the differences above and below that pectinate line. That is something like really important. They are constantly giving the question from there. Is it okay? Now, once you are done with this one, of course, there was a question given about the extravasation of urine also. I have not included that one here. Extravasation of urine is also very much important for your NEET PG exam. Once they have given the question regarding this one. So answer me very quickly. Bulbar urethra will be ruptured in which type of injury? What is the key word for that one? Bulbar urethra, yes, what is the key word? Yes, straddle injury mein hota hai. Similarly, membranous urethra will be ruptured in, that was given in NEET PG. Membranous urethra will be ruptured in, what should be the key word that should look for in the clinical question? Clinical question में आपको कौन सा वाला कीवर्ड देखना होगा? Membranous urethra will be ruptured in. Bulbar के लिए almost everyone has given the right answer there. Pelvic fracture, yes. Pelvic fracture, absolutely correct, okay na? So keep these concepts in mind, my dear friends. That is a trend, and these are all the high yield topics, and you have to revise that before going to the exam. Okay, now coming to the last and final thing here, general anatomy and histology. No doubt about that. In general anatomy, types of joints, हमेशा सवाल आता है, and you have to remember all the examples, all the different types of joint. And when it comes to histology, what is the trend that I have observed in histology, especially when it comes to NEET PG exam, my dear friend? Most of the time it's always about the epithelium, or it is about the cartilage. You can see the cartilage here. Elastic cartilage, hyaline cartilage, and then epithelium. And epithelium also, they are giving mostly the question regarding the transitional epithelium. You remember transitional epithelium, how to identify that one? The topmost layer will be having that umbrella shaped cells. There will be big cells present over there, and there will be umbrella shaped cells. Take it. So please remember, my dear friend, about the joints and the cartilage and the epithelium has to be revised for your NEET PG exam. Okay, so this is like something like really important for you. Okay, so that is about all the topics. The entire trend or the entire analysis that we have done about all the MCQs which are going to be asked in your exam, and which are the topics that you have to actually focus. So this is how these sessions are going to be scheduled. Like first 2 days or 3 days will be given for you people to solve the PYQs. And once you are done with that one, my dear friend, yes, the faculties will be actually coming in discussing the entire trend and which topics to focus on. Like we have seen like so many errors which has been rectified today in our session here. And I told you the topics which not to be missed, like in abdomen topic, don't miss abdomen, pelvis and perineum. Don't miss the topic of anal canal. Please remember that one. Okay. Now, before ending this session, one important announcement for you people, my dear friends. Remember that we have actually made the entire anatomy PYQs PDF, and that PDF of the anatomy PYQs completely free for all the students, and you can download that from the PrepLadder app. Okay, so you can download the anatomy PYQs PDF, entire PDF you can download from the app. Okay, and in the app you can actually see the section. The link will be given to you, yes, in this video. The link will be actually given in the description, or it will be even pinned in the comment also. You can go and see that one. And if you want me to tell right now, in the app you can actually see that in the miscellaneous section. In the miscellaneous section you can actually download that entire PDF of the PYQs of the anatomy, guys. Okay, so by this I'm done with this entire analysis of the NEET PG PYQs. And please remember the advice that I have given you. The important thing to focus, or the place to focus for your NEET PG exam, in the very beginning of the video, starting 5-10 minutes, very much important. I have given you the entire thing, clarity about the tiebreaker regarding the ranks. Please see that one and share that with your friends also, so that even they also get some better ranks. Thank you. All the best. God bless you all.